So I'm really pleased to introduce this panel. This is a one that I've been working with closely over, the last year, and it's really my pleasure to be here today. So my name's Megan Mahoney, and I'm one of the program committee volunteers. And again, we'd just like to acknowledge that the CSPC is taking place on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, whose presence here reaches back to time immemorial. We respect our traditional hosts and thank them for allowing us to operate on this land. So we are about to participate in a really interactive panel called Can We Save Democracy? Addressing the global crisis in science misinformation. Obviously a very important topic. So this is a panel that was sponsored and organized by ISED in collaboration with the CASC. And so at this point, I'd like to introduce Dr. Stan Kutcher up, introduce him to the stage to kick us off. And as always, just a reminder to use social media, to use the hashtag CSPC 2022 and @SciencePolicy. Take it away.
Great, thank you very, very much for that. And just to make sure, if you're looking for the circular bioeconomy, you're in the wrong room. This is on democracy. I'd just like to confirm that land acknowledgement that we just heard. Before we start, I'd like to know who's in the audience. So just show of hands. You don't have to jump up and stand on the table. Just lift your hand up. So let's start with academics. Who is in the academia? Good, good. All these wonderful people. And if you fall in more than one category, you're allowed to vote twice. As a parliamentarian, I have to be careful about saying that. Government, federal or provincial. Wow, good. Well, this is perfect. This going back and forth. This is so important. Media, journalism. Nobody. Oh, a few. Oh, good, 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 good. Yes, yes. Thank you for that. And anybody that I left out? Industry. All right, and civil society, NGOs. Oh, good. All right, well, we have got a really nice coming together because that's so important because everybody here has a role to play in what we're going to be talking about today. Not just identify what the problems are, but identify and then move towards effective solutions. All right, so hopefully we can do that with this panel. Just to introduce myself, I'm Stan Kutcher. I'm an independent senator from Nova Scotia. Prior to my appointment in the Senate, I was a physician, but also a clinical researcher, and I dabbled a bit in something called neuropsychopharmacology. I'm still wonderful. It's amazing I can still say that after being away from so long. For transparency purposes, you will hear a little bit about Science Up First today, which is housed in the Canadian Association of Science Centers, which is a disinformation debunking group that was started by Tim Caulfield and myself. We catalyzed it and wonderful work. And if you're not involved in that work, we really encourage you to get involved in it because we need your help there. The second thing in transparency, I have been advocating for doubling the funding to our tri-councils and for improving thank you, and for substantively improving the salaries for our postgraduate students, masters, PhDs, and postdocs. We've been conscious for about a decade, coincidental with the rise of toxic populism, or as Biden called it, the new fascism, existential threats to our society. There are two, in my opinion, which are primary, and the first one is climate change, and the second one, this is not any particular order, is the disinformation. And my own thoughts on it are, I did Lauren Stokes from my office, and I did a piece in the Science Policy magazine if you want to read more about that. So I've had concerns about this issue for some time now, as have many of the panelists here and many of you. So let's get started. So I will first thank the organizers of the panel, Dr. Marion Mader, who's here. Can you put your hand up? Yeah, thank you. She's the CEO of the Canadian Association of Science Centers, the largest informal science learning network in Canada, and she has been instrumental in the development of Science Up First. And Justin Matthews, is Justin here? Don't see Justin. It's a senior communications analyst, digital communication in the Privy Council office. And thanks to ISCD for supporting the panel. Now, I just want to start a little bit about discussing misinformation and disinformation, because sometimes people use those words interchangeably. They're slightly different. Misinformation refers to false information that is not intended to cause harm. That doesn't mean it doesn't cause harm, but it's not developed to cause harm. And disinformation refers to false information that is intended to manipulate, cause damage, or guide individuals, organizations, or countries in the wrong direction. We got that? Okay, that's really important. Disinformation is often driven by malignant state actors, Russia, China, Iran, and others, and also malignant non-state actors. Very often they are those who are purveyors of false hope through selling you the product on their website. Put together, these threaten health, safety, and well-being of our society, and they also threaten the very democratic structures that our society uses to guide us and create the framework in which we can flourish and thrive as individuals, families, and communities. So this is not a simple issue. So to help us unpack the complexities of this, I want to introduce the panelists. And when I say your name, just lift your hand up so people who know who you are. Carrie Funk, Carrie first, thank you. She's a director of science and society research at the Pew Research Center. And she leads the center's efforts to understand the implications of science for society. And she's come a long way. So give a shout out to Carrie. Show her a good Canadian welcome. Yeah. Rodney Gali is. He has not come a long way.
It was 2 blocks.
2 blocks, yeah. Today, 2 blocks, moving quickly. He's here. He's the Assistant Secretary to the Cabinet and leads PCO's Impact and Innovation Unit, which does the behavioral analysis relating to mis and disinformation and trust. He's also been formerly at the Public Health Agency of Canada, so he knows whereof he speaks. Carly Weeks, Carly. I gotta admit, and I'm not sucking up to you, Carly, but Carly Weeks and Andre Picard are my 2 favorite journalists. So there you go. And she's covered topics ranging from the opioid crisis to overcrowded hospitals and, of course, COVID-19. And last, but definitely not least, an old friend, Timothy Caulfield. Tim. And Tim is the Canada Research Chair in Health Law and Policy, professor in the Faculty of Law at the School of Public Health, and research director of the Health Law Institute at the University of Alberta, and my co-conspirator in catalyzing Science Up First. So we're going to start off this session with a bit of a discussion. I have some prepared questions for each of the panelists. They'll expand on this. And then we're going to go to a free-flowing conversation amongst the panelists where they'll feed off each other's ideas. I may interject a few points just to try to keep them on track, though I know with this group that's next to impossible. And they didn't give me a gavel. Oh well. So, and then after that, we're going to open it up at the mics for Q&A. You're going to hear an alarm go off. That's my phone ringing to tell me it's time to go to Q&A, so don't be alarmed. It's just my own phone telling me I have to switch gears, right? Okay, so we're going to start with Rodney. And the question that I have for you is, what is the data telling us about the pervasiveness of the problem of misinformation and disinformation in Canada, and what impact that might be having?
Great, thank you, Senator. So obviously it's really important, I think, context setting question for today's discussion. At some level, there's no easy answer to that question. It's not like we can sort of quantify the amount of information that's out there in our information ecosystem as a baseline and then understand sort of what is fact and sort of fiction sort of within that. But what I can talk about are some proxy measures that we have been looking at over the last several years that help sort of animate, I think, that question and sort of understand the question of pervasiveness within the Canadian context. And it relates to sort of the impact that misinformation is having on an individual's sort of attitude, sort of beliefs, and then ultimately kind of lead to sort of behavior change, sort of well, either in the positive or in the negative. And so if we look at what's been happening sort of within the COVID context, because I should say too that the pervasiveness of misinformation actually varies from subject matter to subject matter. And so from a COVID context, 2.5 years into this pandemic, what we still see are shockingly high levels of belief in misinformation. And so as Stan was saying, so we do a lot of this research kind of in-house with our behavioral scientists. So we are very much having a very particular lens to this. And what we're finding is 2.5 years later, 37% of Canadians still believe in one verifiable false piece of information related to COVID. So kind of translating that into something really concrete, 9% of Canadians still believe the COVID-19 vaccine causes infertility. So that's about 2.8 million Canadians. So that's a problem. And so if we look on the climate change side, what we see is 1/5 of Canadians, so 20% of Canadians do not believe that the origins of climate change is man-made. So you can kind of see this tracking across sort of issues of significance. If we then look at, I guess, the information ecosystem, the platforms, these are not all the same. And so what we are seeing is the levels of information vary from platform to platform. Some of our unpublished data sort of in this space point to TikTok and YouTube being higher levels of misinformation compared to, and I guess this is kind of surprising, it was surprising for me, Twitter, Facebook and others. All of this data obviously was before the chaos that's now ensuing on Twitter. So that could all be sort of thrown out the window at this point. Our initial sort of thoughts naturally kind of relate to the algorithms that certain platforms use versus sort of others. But what's the real impact of this? And this is kind of the relationship between an individual's attitude or belief and how that translates into actual behavior. And so what we definitely saw during COVID was very strong correlations between sort of belief in misinformation and the tendency to do a number of things. So adhere to protective public health measures, get your first vaccine dose, certainly sort of the subsequent doses. It also links to sort of a parental intention to get sort of your kids vaccinated. And we're now starting to see, again, sort of that translate out on the climate side in terms of support for government's efforts to meet its ambitious 2030 or 2050 targets. And so we're seeing very strong correlations, again, between belief and how that belief actually translates into action. And there's also sort of links, and I know we can kind of get into this sort of later in the discussion around sort of misinformation and trust. But all that to say is, from a Canadian context, it is an issue of top concern as we see sort of governments think about how they will implement ambitious agendas.
Great, thank you for that, Rodney. Sobering. Now we'll go to our neighbors and friends and neighbors to the south. So Carrie, can you bring us your perspective on that, please?
Sure, thank you so much, and it's a pleasure to be here. Like Rodney, at Pew Research Center, we deal in data, and so I think it gives me a kind of broader perspective. I just want to make a couple of broader points about the context. One is we do mostly public opinion surveys, both in the US and internationally. So certainly from those international studies, primarily among advanced economies, you see kind of a high level of global concern about the spread of false information. And Canadians are up there among the most concerned, but they're shared concerns. And a lot of that is coming out of the coronavirus pandemic. You know, these are problems we've had around for a long time, but there's something about it that exaggerated and accelerated the flow of misinformation and some of the opportunities for disinformation from those who wanted to sow sow discord. And certainly, we've also seen in those surveys that many publics have a sense that the coronavirus pandemic led to kind of wider divides in society. And certainly that was true in the US. You know, we had about 6 weeks of kind of consensus building, and then we basically have had the hallmark of our response has been marked by political divisions. And so that has just been true about kind of anything connected, even vaguely, with the coronavirus outbreak, generally speaking, has kind of led to a kind of taking of sides between Democrats and Republicans. And then I want to talk about the kind of where we think this is coming from, particularly in terms of trust. I think it's, many people think of this as misinformation not necessarily causing mistrust, but potentially being a product of a lower level of trust in government and the media and other institutions. Probably a chicken and egg situation where, we had a kind of lower climate of lower trust in institutions that can help encourage a skepticism about the information that you receive. And then, of course, if you start spreading misinformation, then that can encourage further mistrust in government and institutions. So I think very much that is often talked about in terms of this link to other kind of doubts that we have about democratic structures and really this broader conversation we're having around the role of facts in society. So with that, let me turn it over to my fellow panelists so that we can continue.
Great, thanks for that, Carrie. I'm going to go over to Tim, and we've heard locally, Canada and globally, about the problem. You've done an incredible amount of research and know the research cold. What can we think about for effective strategies for countering?
Yeah, thanks, Stan. And I want to emphasize again. You said this right off the top. This is a major problem, right? I love to quote the new head of the FDA, where he suggested that misinformation is leading to an erosion in life expectancy. That sounds like hyperbole, but that's really where we are, right? That's really where we are. This is killing people. So this is an incredibly important topic. The other bit of data right off the top, Stan, is Carrie, maybe you know this research. It was a 19-country study where they asked people, what are the most pressing issues today? And only 5% of people globally think that misinformation is not an issue. And most people see it as a serious concern, right up there with climate change, right? So that's how important this topic is. And the other data I want to talk about, again, just sort of to put this all in context and talks to the issue of democracy, is the interesting work that Frank Graves has done, really controversial stuff, where he tries to really map out, who is believing this, tries to connect the dots between ideology and misinformation. So this is the research that came out not that long ago, just this summer, and it's been replicated, by the way, by other researchers, where he drew the connection between vaccination status and support for Ukraine. Have you guys seen this? It's fascinating research. So if you are vaccinated, you are more likely to support Ukraine. If you are unvaccinated, you are more likely to support Russia. Now, I know that sounds extreme, but his research bears it out. Let me just give you one stat that he had. So he asked people, do you believe that Russia is committing war crimes? 88% of those who are vaccinated believe that, and only 35% of those who are unvaccinated believe that. That is a huge gap. That is a huge gap, and again, it's been replicated by other researchers. Some research done in the United States came to the same conclusion. Holy cow, a lot going on in that data, right? It tells us that, number one, this is about ideology. Number two, beliefs cluster, right? They cluster. This is about in-group signaling and being part of a community. And number three, yeah, state actors are involved. This is an issue on an international level. Can we do anything about it? There is a good news story here. There is research that tells us that we can respond. We have more and more empirical evidence on how to respond to misinformation. I think that's kind of a silver lining to what the pandemic from a research space. You start having these bigger studies, and I think Rodney would back me up on this, where we've looked at misinformation. So we know we can do something about this. There was a really nice study that came out this summer where they talked about the multi-prong approach to fighting misinformation. It's obvious to everyone in this room that we have to take an multi-prong approach, but it's good to have the data. So what does that mean? You've got to pre-bunk, right? So you got to tell people the misinformation is out there and how to look for it. You've got to debunk. Yes, it really does work. I know it feels like it doesn't work, but it really does. It really does work. You've got to regulate. So yes, there are times when you have to deplatforming. We need Health Canada, Public Health Agency, Truth in Advertising. We need all of those tools to be deployed. And we've got to nudge. We've got to think of behavioral strategies that we can use, like just inviting people to pause, even if just for a moment. Really interesting work by David Rand from MIT and Gordon Pennycook from the University of Regina talked about if you can just nudge people to pause, even for a moment, we live in a frantic information space, right? If you can get people to pause, even for a moment, less likely to share misinformation, less likely to believe misinformation. Gordon's research highlights again and again, people want to be accurate. Most people want to be accurate. They don't have a nefarious goal to spread misinformation. So those nudges really can make a difference. And so, I think we need to remember that this is an incredible problem, and I know everyone in the room knows this, but the good news is there are tools that we can use to move forward. And at Science at First, we try to do exactly that.
Thank you, Tim. And now Carly, you're on the ground. You're at the cutting edge here as a health journalist, and you're able to get messages out, but I know that you've suffered from getting messages in. And what effective strategies do you see from your vantage point? And particularly, would you speak to the role of trusted media?
Thank you for that, Stan. So journalism has gone through some problems in recent years. We're at a point in Canada where, the future of the Toronto Star now seems uncertain. One of the leaders of our three parties has promised to take away funding from the CBC. Journalists are losing their jobs left and right. And I think traditionally when we talk about the problem of misinformation and disinformation, there was once upon a time, if you go back to, the 1920s, when there were vaccine mandates being brought into Toronto to deal with the smallpox outbreak, there were protests, there were people marching in the streets, but at the end of the day, it was sort of the public got their messaging through the media. And we're now at a place where 2/3 of people are getting their news from social media. And what does that look like? In some cases, they might be sharing links from a place like the Globe and Mail or the New York Times, but in other cases, they're sharing links from organizations that are, sort of masquerading as news outlets, but they're really being, funded by bad actors with varied agendas. And I think that, to the other panelists' points, these problems have just been made so much worse by the pandemic. So I think that, every day we encounter misinformation and disinformation on the job. COVID has made it so much worse. I actually was speaking to a number of healthcare professionals over the summer who were sharing some of their experiences of on-the-job harassment. One doctor in particular was recounting how many patients he was treating at a hospital for COVID who were, screaming, yelling in his face, their family members abusing him until the moment where they were being put on a ventilator. And that's when they sort of finally clued in and started begging for the vaccine. And I think we've all read these stories before, but the things that health professionals have been enduring and scientists being harassed, journalists being harassed, we're at a place where we really need to stop and figure out how we move forward. And I think to Tim's points, this is not just, I'm just sort of framing some of the problems that we do see. But I think, going forward, we have to make better communications a much stronger priority. So for instance, I can write a story in the Globe and Mail that will be read by, people who are tuned into our channels. But if you're, in a certain demographic where you're sharing news on Facebook or you're primarily on TikTok, you're not necessarily going to see those messages. And there's fewer and fewer people who are able to do those jobs. So I'm in a really lucky position. I get to work as a health reporter at one of the best newspaper in the country, and that enables me, time and space to talk to experts. But for the most part, and journalists hear the criticisms all the time, that we got it wrong or it was not accurate. And there's people who are covering City Hall sports health, news, the local dog fashion show, you name it. So it's really hard to get news reporting accurate. It's hard. It's a tough, and it's getting tougher by the day. And I think that this is an opportunity, and I think there's obviously a lot of government people in the room, to double down and think even harder about how we can contribute to good messaging, making those good messages go viral on places like TikTok. And it's hard to do. It's hard to communicate science that is so nuanced in as we were speaking about this before. Fear is really easy to sell, and it's really easy to make that go around the world in a couple of moments. But I think that, if we don't do more to really make sure the public is getting, the people who are busy out there, who are just scrolling through their feeds and are getting bad messaging, how do we break through that, making them pause, finding new ways to really let people know these messages, stop the spread. Anyway, I'll stop there because I've got more to say, but I'll let the rest of the panel take over.
Well, that's, well, no kidding. Well, I'm just going to ask other panelists to just jump in on that. I just want to put a little bit of frame around it. Certainly what I see on social media, but also in my email inbox, is this inchoate anger. It's just this anger without any positive components to it. And without the modulation and empathy that can happen with face-to-face interaction. So can someone pick that up from what Carly was talking about and go with that with the social media components?
Yeah, there's absolutely no doubt, and all of my panelists know this, and I get asked this all the time. I've been studying this for a long time, and so what's different about this, Tim? Social media, it's a cliche to say it, but there's a body of evidence that tells us that social media really has changed the spread of misinformation. That's obvious. But it is getting worse, Stan. How many people in here are on TikTok? Be honest. Okay, not that many. I saw like 6 hands, right, Rod? 2 billion human beings are on TikTok now. 2 billion, and for some demographic, I think it's 30 and under, it's the primary source of not just entertainment, of information, of news and information is on TikTok. Some studies have suggested that 20% of what is pushed through the algorithm, Stan, right? Pushed on TikTok is misinformation. And for some topics, like the COVID vaccine, 50%. We just did a study that was published in JAMA it just came out a couple of weeks ago on monkeypox and misinformation and the speed. So what we did is there was a World Health Organization announcement of monkeypox, and within a day, it was absolutely filled with misinformation. So it spreads incredibly quickly. And so what that means is we have to get on those platforms, right? We have to take all of this very seriously. We have to make shareable, engaging content that can get on these platforms to counter that misinformation. And again, there's evidence that tells us that really can work. Anecdotally, in our study, we didn't publish this data, so this part of our study hasn't been peer reviewed, but we did find the corrections also spread. So that's good news, right? So there were these misinformation that was about monkeypox, and then there was great engaging content that countered it, and that spread too, right, Stan? So that's good. That is good news. We can get on these platforms, and we really can make a difference.
If I could just, so I think those are all great points, Tim. I just want to sort of build on a few of the things that you just said, and Carly on a few of the points that you made. So I just want to start with, I think, again, some context setting. And Senator, you and I were kind of just talking about this before this session. So there's a number of papers that have just come out talking about I guess the societal sort of impacts coming out of large pandemics. And so, kind of retrospectively looking at what happened over the last, 200 years and the civil unrest that normally happens after what you see happen during these pandemics, which is actions of government that are atypical. And so, government acts in ways that don't normally happen during sort of times of non-pandemic sort of environments. And so we see that taking place obviously sort of right now. And we see that kind of happening globally. Obviously everyone here in Ottawa kind of saw that play itself out earlier this year. And I think Senator, the anger that you are talking about is clearly sort of a reflection and a manifestation of that. And without a doubt, sort of our information ecosystems accentuate that. And there's no turning the clock back on any of that. But I think what we need to then obviously start thinking about, and I think taking this whole of society and multi-sectoral approach is the way, obviously, to do that, is we need to recognize that fundamentally the way we think about community is different. And so community is no longer about your neighbor. It's no longer about people that may sort of share the same demographics as you. It is fundamentally now about us finding people through these platforms that we associate with based on our values and beliefs and sort of attitudes. A lot of the data that we collected during the pandemic and now we're collecting sort of on the climate side are clearly pointing to what are higher predictors of someone's behavior. And so that's, people that come together based on their attitudes, beliefs, and sort of ethics. What are very much lower predictors of behavior are typical demographics. And so age, socioeconomic background, sort of gender. And so knowing that, what we need to do, obviously, is then think about how do we tap into those sort of communities and those new types of communities. And so this is where the whole issue of trusted messenger comes in. And so it's, I think we fully recognize that there are people that will listen to government messaging. And there's a very clear segment of that. And, you're right, Carly, that doesn't sort of penetrate into a lot of these communities. And so what we need to do is find those voices within those communities that are receptive to what we think are the facts of whatever that issue is, and have them carry that within that community, and not sort of government, not at times sort of the quote mainstream media, because that's not what they're listening to, that's not who they're listening to. And so I think this is, again, pointing to a very sort of complex information ecosystem that I think unfortunately requires a rather complex response.
I would just jump in on that because that's exactly where I wanted to go. So thank you. It's the word communities, okay? Communities. We need to stop thinking about mass messaging, okay? Because we are actually fragmented into many, many, many different communities. I wouldn't give up on neighbors and direct contact either. I spent a lot of time since the outbreak with public health officials of one kind or another. And, of course, so much of what they do is on the ground in local communities and building trust through a network of trusted leaders in those communities, and kind of answering people's questions about why this vaccine is safe, what makes them convinced, and therefore what might convince someone else. So I think there's a lot of lessons to be learned from that, because we are segmented into so many different kinds of communities, both online and at home. And as we're thinking about solutions and the idea of building trust and building a space for listening to information that is not always available, we need to be thinking about how to reach out within these communities with trusted leaders in those communities, using community-based research to take lessons in terms of what people need, what would work in those communities, and it's definitely not the same across the whole nation.
Obviously, community is a huge issue, but one of the challenges, and I'm curious what you think about this, Carrie, is when that community really is so much about ideology. So in the United States, the number one predictor of whether you're vaccinated is whether you are a part of the Republican Party. Number one, more than race, more than income, more than geography, and more than insurance coverage, which is fascinating. There's a study that came out, I'm gonna say today, that found that in the United States, intention to vaccinate your kid was lowest among white Republicans, so including blacks, Hispanics, Asian, which is incredible. If you think about the history of race in the United States and the breakdown of trust in those communities, and despite that, the number one predictor is whether you're a member of the Republican Party. And then that raises the question that both Rodney and Carrie talked about, how do we reach out to that community to get trusted voices? So there was a fascinating study, I don't know if you guys saw this, where they paid, did you see this, Carrie? They paid Fox News viewers to watch CNN. And think how cynical that is. Everyone in this study knows you're paying me to watch Don Lemons. It's not going to work. It worked. It worked, and it worked on every metric. Have you seen this study? Yeah. On every metric. And that's a really good news story, right? Despite the fact, they knew they were being paid and they knew what the whole game was, it still had, so being exposed to these other perspectives. Now, to be fair, when they went back to Fox News, their opinions regressed. I shouldn't say regressed because that demonstrates a bias. Went back to where it was before. So that really shows that we can make a difference. And of course, there's a really interesting data around when Donald Trump announced he got the booster, and there's been some other interesting studies that have shown that finding these trusted voices within these communities can really make a difference. And we try to do that at Science Up First. We try to partner with all these different communities to get voices from those communities and to co-create with those communities in a meaningful way.
All right, you set me up. First of all, in terms of Republicans and vaccine, there's perhaps a little known fact that older Republicans, majority of whom are vaccinated, so there's this intersection between essentially what people saw as their self-interest and their greater risk if they were older for complications from COVID, and essentially the need to get a vaccine. And that's going to lead me to say, that we shouldn't really paint Republicans with one brush, right? That just like anyone else, we can listen with empathy and we can kind of try to segment who these people are who are most skeptical. And that's basically what we try to do all the time to try to capture public opinion. You're constantly trying to empathize with other perspectives. And that can be hard sometimes because you got to put your own perspectives aside. But one thing that's possibly not popular here is I want to talk about the need to avoid black and white thinking around science and health information. Sometimes in these conversations, it seems as if it's all 100% clear. But I would say from the user side, it's never 100% clear. There's so many different voices. You can always find your personal physician who has a different recommendation and different interpretation of the medical literature. It's so easy to be confused. And that was actually one of our main findings. It's like even the people who understood that scientific information was always changing and that was a good thing for scientific progress also said it was confusing during COVID. And, and I share their perspective. There was a lot of information. So I want to have a little bit of empathy for those perspectives and to realize that there are people that might have a more conservative orientation or might have concerns about the policy recommendations that are kind of being bundled together with the science. And if there's a way to separate out what the science said versus what the options of recommendations might be that would be consistent with the science, then I think we might have some chance to have more bipartisan support.
I just wanted to jump in on that point about those communities and something that Tim was saying as well. So you think about like people who are watching Fox and sometimes I do just it's incredulous some of the things that they say, but they have so much in common. The hosts of Fox News, the people that run that network with some of the anti-vaccine groups that I've covered. And that is that they have a real strong vested interest because they get paid really, really well for selling their message. And one stat that is really depressing is how much more money some of the leading anti-vaccine groups in the United States got as the pandemic sort of progressed. We're talking people that are making millions of dollars basically as a direct result of anti-vaccine, or sort of COVID-denying messaging. And so whether you're in a community where you are, a male middle-aged Republican or a young mother who's getting people are getting a lot of this information on places like Facebook. And so I think there is that intersection of these communities. They all kind of meet online. And that becomes really hard to combat, which again comes back to this idea of how we combat that. And I think there's many ways. But just like one quick anecdote, we've all seen what's gone on in Alberta. Sorry, Tim, but there has been a very active, and I'm part of this Facebook group. It's I think it's called Families for Choice, and they're basically like they cast themselves as a grassroots advocacy group. I think they're like 70,000 plus members now. So basically, it's a Facebook channel. It's a private group, and the thing, it's a very activist type group. They claim that they're, the ones that convinced Jason Kenney to repeal mask mandates earlier in the spring. I mean, they obviously have some kind of leverage because they do bring in, and they somehow are funding sessions with doctors, and they've received sponsorship and things like that. But this network is very strong, very active, and this is sort of fuel to people that are kind of maybe sitting on the sidelines, and a friend tells them about this group and they join, and the messaging just is so convincing. Even someone like myself who knows sort of like what's real and what's not real, it's really hard for the average person who has so many other things on their mind to suss out what's real and what's not. And I mean, not to say there's not a way around it, but the sheer volume of misinformation and disinformation people are exposed to daily it just engulfs their mind. It's becoming harder and harder for people, like real smart, intelligent people, to really see what's going on, what's real and what's not. And yeah, as I think it was Tim that said, like, this is the scope and scale of this problem. I think most of us don't even really understand it.
Well, thank you all for that. I just want to reflect on something about this intersectionality of negativity and of false information, and going down these rabbit holes. It almost doesn't matter which rabbit hole you go down, you end up in the same place, because the cross talk down these holes is the same. About 2 decades ago, I was reading in Harper's that there was a correlation coefficient around 0.7 if you were pro-capital punishment, anti-abortion, and believed that Elvis was still alive. That was funny at the time, but it's not funny now. And that has substantive policy implications for how do you take this kind of cesspool of disinformation and massage it into effective public policy. So you're sitting right here, and I'm going to give you that one to start with.
Sure, I'll definitely kind of take that on. And I guess maybe the way I'll start is thinking back to earlier points in my career, as you kind of mentioned, sort of in health and public health, where this idea of misinformation was something that we knew kind of existed as a policymaker, but it was typically viewed as sort of inconsequential. It's actually where Tim and I first sort of met years ago, in the area of sort of natural health products, et cetera, as, Tim was obviously working very hard to debunk that, and as a policymaker sort of within Health Canada kind of acknowledged it, but it's fine, we can kind of move on. That all changed during COVID, where it became very clear that what was a side of desk issue is now a center of desk issue for government. And so we can no longer ignore this issue of misinformation because it has become a clear disruptor in trying to implement a government agenda. And so we see that again very clear as the links between those that believe sort of in misinformation and the trust that that individual has for government officials, government communications, and obviously support for government policies. And so as we move out of this COVID context and we think about sort of the ongoing crisis of climate, for example, and I already gave that stat around those that believe in man-made origins to climate change versus those that don't. If we have any hope of meeting those targets and we don't have general consensus in the origins and try to implement policies within that context, it's going to be next to impossible. And so this is no longer an issue that we can ignore. It's one that, as all of us have sort of said, is linked as we kind of characterize it, a symptom of these larger societal challenges and I think this kind of speaks to ultimately sort of the title of this discussion. If we want to continue to enjoy the democracy that we have and the public institutions that we have that actually have served us very well for a very long time, then it's something that collectively we need to address.
Yeah, I think I'm going to use this as an excuse to talk about, Stan, what you said. You started with that, that funny anecdote, but I think it's really important to recognize that what we are talking about is disinformation. It is misinformation, because a really common narrative that has emerged, and I think it's accelerating, it's gaining momentum, is this idea that this isn't misinformation. You guys are trying to silence a particular narrative. You're trying to It's cancel culture. You're trying to stop academic debate. No. What we're talking about is clearly misinformation. In fact, I'll often ask people, name one credible scientific debate that was silenced. And you can't. People are having those conversations openly. I've been on committees and policy groups. They're having those conversations. Nothing's been silenced. What we're talking about is misinformation, and I don't think we should give up in the public conversations about this on that. We shouldn't let them move the goalposts. Let me give you again some more data on this. And Carrie's point is super important. Not every conservative is an anti-vaxxer. In Canada too, by far, most people who vote conservative are vaccinated. Like, I can't remember the exact numbers, but those who are unvaccinated are very likely to reside on that side of the ideological spectrum. And again, lots of research have shown that in Canada and in the United States. And the other thing it's shown is that people who aren't unvaccinated, and we could do this with climate change and other topics, but with people who are unvaccinated because if you ask them, they've embraced misinformation. Right? At the early in the pandemic, there were issues of trust, understandable trust between communities and institutions. There were issues of access. There were issues of needle phobia. There were issues of equity. All of those things are still out there, and we have to be vigilant and constantly monitor them. But if you look at the 9% of Canadians who are unvaccinated, and you ask them why they're unvaccinated, misinformation is almost always part of their response. The stats bear that out, and I've personally experienced that. People will come up and say, "You've called me an anti-vaxxer. I think it's unfair to characterize me that way." And I mean, really, I have these conversations a lot. And then you ask them why they haven't got vaccinated, and it's always hardcore misinformation. It's hardcore conspiracy theories. It's not, well, I'm not sure about how much immunity I get from Omicron and what the best time to get the booster shot is, and I'm worried about the relationship between myocardia and, it's not that. It's not that. It's microchips. It's changing my DNA. It's that the vaccines kill people. That's the number one thing I hear. The vaccines are killing people. I know people that have been killed by the vaccines. That's what I hear. And so I think that we need to make sure that we remember that we're talking about misinformation and not to let this debate, this policy discussion get derailed as it is in the United States, as it is in California, as it is in my own province, with this idea that this is about freedom of expression and not allowing a cancel culture and making sure that we have diverse voices at the table. And I'm sorry I'm gone on too long, but I'm kind of passionate about this. False balance is also a big issue, and it's becoming a bigger issue. It's something that we've studied. We're seeing it, unfortunately, in the popular press too much around things like immunity debt. We can't let that win, right? We can't let that win.
Just to add to that point, I mean, even it's so pervasive. Misinformation is so pervasive. And I really refer to misinformation because there's things that get repeated, or someone hears something and they think that idea that vaccines somehow cause infertility, right? Like, no one even knows where that really came from, but it's sort of out there in the ether, and now 10% of us or 20% of us, one-fifth believe it. 9%? Okay, 9%, sorry. This is my journalist fact check.
But I think 25% are open to the idea.
So, and then before the pandemic, and I'm sure it's even higher now, something like 30% of Canadians believe that vaccines cause real bad safety risks, like not side effects like a sore arm, like lifelong permanent damage. And just to speak to this idea of how pervasive it is and how damaging it is, only 1% of kids under the age of 5 have been vaccinated twice against COVID. And the vaccine's been here for about 4 months. And I think that just really, now there's maybe some access issues there and people who are waiting because they've had COVID recently. But I think that, for a big part of that 99% is because of the doubt that has been put in the parents' heads because of something they heard or saw someone talk about or reference to online. And that's the kind of thing that's really challenging to get at, but is a huge part of the issue too.
And I just want to ask one other slight wrinkle on what you've been talking about before we go to questions from the audience. So this is my cue to you. If you want to ask a question, go stand up at one of the mics. All right, and when you're going to ask a question, it's a question, not making a statement. Got it? Okay, good. We're good. We're good with that. But I want to focus, Carrie, and that I'm going into a little bit of a minefield here, but that's okay. We're not elected. And that is the issue of political leadership. In the United States, the president was disinformer-in-chief. And we're seeing increasingly within our political leadership, people embracing and putting forward very, very clear misinformation, very often disinformation, particularly in the health sphere. And that's causing us a lot of problems. Not to malign the US, but the things that we've seen there are starting to creep over the border here. What are your thoughts on that? How do we address that? What can we do?
I thought you were a friendly audience. Okay. I mean, as a social scientist, I do agree with the theories around how essentially elected officials and other kind of prominent leaders can help drive public opinion, essentially. When we talk about tribalism and people kind of lining up with their side or the group that they think they're part of, that's what they're talking about, is that you have these kind of public voices who kind of signal what views you might want to take. And then you, if you agree with them, you line up on that side of the room. That they say that's an old policy. You stood with your candidate, and then you adopt those views as well. And actually, in that process, often the more people who pay most attention to politics are the ones that most closely align. So the point there, I think, to your earlier point, is why did we have such a strong political divide? And certainly one argument is that we had divisive messaging from the highest level about whether this was a real threat and what to do about it. So we had literally 6 weeks of kind of consensus, and then we had this widening divide that just continued over time. But I think it also gives us a point in terms of thinking about communities and who to reach out to and who can be trusted leaders. This is an opportunity then, if you want to have more impact, right, to be working with leaders that might be receptive to kind of get these messages out the way we think will work the best to protect public health.
Anyone from the Canadian side care to make any comments on this? And then we'll open it up to the microphones. No brave people? All right. We see people at the microphones, wonderful. State your name and where you're from, and then your question, please.
Jean Sainville, I'm with McGill University. My question is with regards to nuance. At the beginning, you mentioned malignant state actors, and you name a number of countries. I'm wondering if it's really that black and white. Have we not had the countries that are identified today as leaders of democracy use propaganda at the time of war, not inform their populations about, for instance, experiments that were conducted against black people during the time of enslavement, for instance, which led to the lack of trust. And the second part of my question is, what is the danger of the mainstream media in Western democracies being very close to their political leaders and therefore losing credibility in the eyes of the general population? You know, we've all seen those dinners where there is a roast of the president, etc. Do these things contribute to public trust augmenting or skepticism in the population?
Well, I'll jump in on that last point. One thing you're probably referring to is the recent politics dinner, the press gallery dinner, where the press gallery invites politicians and others to kind of have an evening of drinks and wine. And it's funny because I did see some people, online talking about how the journalism elites and their well-paid friends, and the remark is often, if you actually saw what journalists make, you you would probably just be horrified because it's so low, not because it's so high. I think there is a point to that. I mean, I think that journalists have often had a really cozy relationship, like those that work in politics, for instance. That being said, I think that sometimes the perception online reads a lot differently than the reality. This is perhaps me, my colleagues that work on the Hill, fantastic at what they do, and they hold the government's feet to the fire. I wonder, I mean, I do think that there's a debate to be had there, but I often think that the biggest challenge with freedom, trust in the press right now is the fact that there are so many people who are actively eroding trust in the press by coming out and calling the media liars. And I'm talking about people that are elected officials, lead provincial and national parties who are outright calling media liars and are furthering this idea that we can't be trusted. And they're doing that because it suits their own gains. It's easier to talk to someone who's on your staff into a video that's going to be posted on YouTube than it is to sit down and have a real Q&A with a reporter. So the best thing to do is just to get rid of the reporter. And that's what is increasingly happening and what makes it harder to combat misinformation.
Tim and Carrie.
So Carrie, you go ahead.
I mean, the issue there is it's hard to prove, but we think that vested interests are driving some of these conversations. I wanted to pick up, I think, the first point, which was that sometimes governments deserve our mistrust. And, and this is partly why I was saying you need to work within communities who have that reason for mistrust. But a lot of times when we talk about what to do about it, the institutions, the agencies, they need to focus on what they're doing to deserve public trust, and sometimes not enough. Part one, I think one of the things we want you to take away is that you need to assume that you have to explain and justify your recommendations to the public. That's part of communication, and that needs to be part of it. It's not communication's not PR. It's actually explaining why you believe this is the best policy, what you think the facts are, the degree to which there's uncertainty. And I think and the idea of being trustworthy as an agency is much broader than just communication. So it's how you treat people, it's eliminating the inequities and so on. And those are really important principles. These are kind of ongoing goals that you should always be aspiring to if you actually want to deserve public trust.
Real quickly, I think the first point that was made is so important. We absolutely need nuance in this analysis. And that's one of the reasons Science at First tries to work with communities. We have great partnerships with Indigenous communities to do exactly that. And there's no doubt, I think, especially early in the pandemic, if you're just looking at pandemic and vaccines, the trust issue was huge. Heidi Larson has done some really great work on the vaccine trust issue, and should not, we have to constantly be vigilant. And I always hope that one of the legacies, and this is a naive wish, and it's becoming more naive with each passing month, is that the pandemic is going to remind us how important trust in institutions, having trustworthy institutions is, and institutions that deserve our trust. And that has to be one of the top priorities of a lot of the institutions in this room. I will say this, one quick caveat, because this again goes to the role of misinformation and the reason we're here today. There was another study from the United States, very, very recent, I'm going to say over the last couple of weeks, where it looked at a lot of these communities that in the United States where they thought a breakdown of trust was really the issue. And they found even with those communities, it wasn't that breakdown in trust, it really was misinformation. So those who weren't getting vaccinated because of misinformation, not because of a lack of trust with the institution. And by saying that, I do not want to minimize the issue of trust, which I think is absolutely paramount.
Right.
Hi, Leah Geller. Oops, sorry, too close. I'm a science writer. I'm here on behalf of Research Money Magazine. Could you tell the story of maybe one or two innovations, great ways that best practices for battling misinformation, whether they're from Canada, the United States, maybe even Europe, overseas, things that have worked, and just telling one or two of those stories?
Great. So I'm happy to start sort of with that, and it actually picks up on something that Tim was talking about, which was a previous study by Pennycook on in essence, introducing sort of frictions within a social media environment to help kind of short circuit, I think, the impulsiveness that we all kind of share when it comes to those environments. And so this is recently released data from sort of our team in partnership with the OECD and government of France, where set up, so this was in a controlled environment, set up a mock sort of Twitter environment where we had X amount, about 2,000 sort of Canadians playing in this space, trying to test out sort of their tendency to share information that they either suspected was false or that they knew was false. And what we found was by introducing, in essence, what we were calling sort of media literacy tips. So like 5 quick questions that someone could just scan through that in essence would give them a 5 to 7 second pause before they hit the retweet button that would allow them to just sort of question what they were about to share, demonstrated a 21% reduction in the sharing of that information. So it kind of speaks to a couple of things. Like number one, it kind of speaks to the fact that in essence, there is not always something nefarious behind someone sharing sort of information. It may just be that they look at it, it is in the zone of what they're kind of thinking about, and then they kind of share it within sort of their networks. Number two, it demonstrates that we inherently have that impulsive nature in us, and there's a rapidness and a rhythm to social media that if we can introduce some frictions within that, it demonstrates there's some hope in helping to stop sort of that spread. There's a lot more work that kind of needs to be done. There is a growing body of evidence, but it's a really small body of evidence with respect to sort of how information is shared across social media platforms. And it actually varies from platform to platform. And there's actually a growing body, but still a very small body of evidence that really sort of understands like how this information is affecting sort of people's beliefs and values and sort of ethics and sort of behaviors. And so, to the whole point of sort of upstream and downstream sort of interventions, pre-bunking, sort of post-bunking, there is work underway, and we are starting to demonstrate that there is some hope, like to Tim's sort of optimism from earlier, that not all is lost. And I think it's about sort of recalibrating these environments, knowing now what we know in terms of how information is shared.
Anyone else want to take a quick crack at that?
Really quickly, there's great stories going back to the last question from the United States. I mean, Carrie can maybe even comment this. We're working with the Black communities, Hispanic communities, religious communities, and having the leadership within those communities make a real difference with vaccination. And I think there's a lot of really good news stories in the United States from that. And we've seen it also here in Canada. So those stories are out there, those community stories that demonstrate, especially when you bring together, the science-informed strategies for debunking and for pre-bunking and working with the communities.
Thank you. Go to the microphone over there, please.
Hi, Dr. Jennifer Geddes McAllister, and I'm an immunology professor at the University of Guelph. And I certainly get on my soapbox for my immunology students to tell them about vaccines. But I'm wondering, aside from shutting down social media, and you've touched on this, how do we fight misinformation? How do we rebuild that trust? What are some tangible things that we can do?
Who wants to take a crack at that? Tim?
I feel like I'm talking too much, so. That paper I referred to earlier, I think really does give a nice way forward. So what we want to do, and there was another study from Lewandowski's group, Stephen Lewandowski's group on pre-bunking that really demonstrated how effective these tools can be. In fact, they were very optimistic about their results, very similar to what Rodney talked about, where they very, very briefly, I mean, these things have got to be brief, right? The attention spans are short. Very, very brief reminders of accuracy, basically. Just to get people to think about accuracy can have an impact. And there's some, again, preliminary research suggests that even if you frame your message in a way that reminds people to think about accuracy, they're less likely to believe misinformation. So adopting those kind of pre-bunking strategies really does work. The other thing we need to do is we have to be on social media. And this goes to this conversation about, I thought we'd go the entire time without saying Elon Musk, but here we go. we're in a really weird space. There's a really weird tension. Do you want to be part of this, this mess, or do you want to get out and go to some other place where you feel more comfortable? And unfortunately, I think we have to be part of the mess, because if we leave, then it just becomes this massive echo chamber. So again, if you look, there's been some really big data studies that show that good content can make a difference, especially if it's fast. So pre-bunk, debunk, do it with speed. We also want to, critical thinking skills, also incredibly important. A lot of interesting studies have shown that teaching critical thinking really can make a significant difference. There have been fantastic studies that have demonstrated that around the world, cross-culturally, that it really can. And we're not talking about, a big science class, really straightforward skills, asking people, what kind of evidence is being used in this? Those simple questions can make a measurable, significant difference.
Carrie, I saw you writing furiously.
Oh, no. I don't have any solution.
Oh.
I'll quickly add one, and again, to be optimistic, I'll say something negative and then go to the positive. But the main place where we were often told, in interviews with every expert I've talked to, go to your primary care practitioner. That's the place where people can get good information about whether it's vaccines or screenings for diseases or things like that. And we're at a place where many millions of Canadians don't have access to that, and those that do, their doctors are too busy to see them. So we need to start thinking about how we empower some of those community ambassadors who are doing such heroic work, and they've been doing throughout the pandemic, how we empower some of those groups to expand their reach and do even more, because there's some real potential there.
Great ideas.
Thanks very much. Shannon Bard for the University of British Columbia. So my question builds on the discussion that we've been having for the last few questions, and it's about demographics. So thinking about trust in institutions and misinformation, I sort of see it falling into three groups. So you have the sort of people with entrenched views where that has become their identity. And so they have a vested interest to keep that anger going. Then you have the sort of curious groups that, Timothy, you sort of described, where they're sort of open. They don't realize they're exposed to misinformation. And then for those of us that have teenagers at home, we have the young people that are having digital literacy training at school. They're at the table with us. They're hearing things, but they're starting to create their own opinions. But they're malleable. So maybe you could talk about how you might have different approaches for those different demographics.
Sure, maybe I can start. And it almost sounds like you may have seen some of our unpublished data sort of on both how we've built some behavioral profiles, both in the areas of trust and sort of misinformation, because it does sort of track along those three sort of groups in terms of what we were calling sort of misinformation resistance, those that are susceptible and those that are endorsing. And so on the resistant side, about 50%. Those that are susceptible around 20, and then 30 for susceptible and 24 resistant. So again, what I would say is there are some demographic links or characteristics in those three areas. I would say that they're, again, kind of a weaker predictor. And it kind of speaks to all the things that we've sort of been talking about, which is sort of understanding, I guess, how we are kind of aligning ourselves from what our values and beliefs are. And so once we sort of understand that, that's how we start tailoring, I think, our responses. And so, on the resistant side, it doesn't mean that we sort of ignore that part of the population. As, governments and sort of trusted institutions, you keep kind of engaging in the way that you kind of engage those that are susceptible. This is when we have to actually be much more in a partnership, in a co-design, co-implementation sort of model, where we are looking at communities and having others kind of carry that voice. And so both within, our social media environments, but also sort of on the ground. Let's not forget, sort of, there are still people that kind of get together and do things together that you can help sort of influence behaviors as you move into the other side. On the last, in that last bucket, obviously that's going to be the hardest sort of area, because they are the most sort of entrenched. And again, it's not that you ignore that, but I think, at least from our perspective, more work needs to be done to sort of understand what's underpinning the absolute sort of resistance to what we believe is obviously facts and sort of correct information, and how we can sort of correct that.
I think your breakdown is excellent, and I'm just going to add to something that Rodney said. There's an ongoing conversation in our community, and maybe you guys have even seen this. Has the number of people who believe hardcore conspiracy theories really increased? Right? There's this really interesting discussion going on about that. I think it has, but we're still talking about a relatively minor group of people in Canada and in the United States, but probably in the single digits, right? It's very hard to change, but we know that the messaging coming from that community can impact the other group, right? So we can't ignore them because of that. I mean, think about the stat that came out this summer, and again, this work has been replicated by other survey groups, where they found that only 56% of Canadians were willing to say this is not true, that vaccines are killing people and the government's covering it up, right? So only 56% of Canadians, right? And that is a lie, right? That's a hardcore lie. So I don't think those, was it 44%? I don't think those are hardcore conspiracy theorists. They've been influenced by the hardcore conspiracy theorists. So that's where we have to, so I always think we should still talk about those hardcore conspiracies. We should still debunk them because of the influence that they can have. The youth is very interesting, and Rodney probably knows this data better than I do. I'm sure Carrie has some data on this too. It's messy, because there's some evidence, especially recent evidence, that they believe more conspiracy theories. I don't think it's because they don't have critical thinking skills or they're dumb. They're just exposed to it more, right? It's just that exposure factor. So I do think we need to tailor messaging, get them involved, and thankfully there are a lot of great voices, young, creative voices that are now becoming part of the conversation.
Thank you. Carrie?
Sorry, I will just jump in. I mean, part of it is that I'm very interested in solutions that would work at scale, and a lot of the studies out there show you what you can do at an individual level, and they just don't scale up quite well. And so that's why you do hear a lot of complaining about the tech companies and social media companies needing to do more to get the information off the platforms. As you can see now, they've invested a good amount of money into it, and they have a lot of trouble doing it. They can't get it all out. They can't get it all out at speed. I mean, the whole reason we're so worried about the flow of information is because it travels literally around the world within such a short period of time. So that's why I think, to Tim's point, we need to keep doing what we're doing to try to actually go to where people are in terms of these sources of information. One of the most interesting parts is really that the blending of entertainment and news, right? You're not getting this information directly from a news source. It's all kind of just mushed together in our TikTok feed. And so this is what's making it hard. But that's what I keep thinking about, is how can we actually do something that will have more impact at scale? And that's why I think Carly talked about, empowering the ambassadors. This kind of networked approach is, to me, where the potential solutions lie for having an impact at scale.
Thanks. Over to this microphone now.
Thank you. I'm Dr. Samuel Ujewe. I'm a senior ethics advisor with the Canadian Institutes of Health Research. There's a lot of discussion about the lower level or grassroots democratic process, and I want to ask a question on the high-level democratic process in terms of misinformation at the high-level political process. I'm originally from a country where a vaccine is not a question, you just take it, because we live with the reality of the diseases, so we know. Now, if we're in a country where the reality of the disease is a concept, it's not a fact that you see around. So when you are being told and information is circulating on social media, it's easy to follow. But then there is a high-level leadership that should be able to feed the grassroots with the adequate information to help to digest what is happening, because the experience is not there, except for COVID, that has kind of given us a light somewhere. But the high-level leadership does not appear to be not well-informed, properly informed or adequately informed about the scientific process, for example. Sometimes during the COVID, we see the conflicting information. If it takes someone who is following very closely and who sometimes understands perhaps a little deeper to be able to make the difference. because the information, the people we're relying to give us the information, they seem to be confused sometimes because there's conflict in the information that comes between days or between weeks. So how do we avoid, and the reason why I'm asking the question this way is because I believe that is a misinformation in a sense, or a misunderstanding of the information at some point that can create even more doubt or distrust at the grassroots. So how do you address that kind of problem of misinformation at the high political level, which can become the key driver to removing the distrust or disinformation or misinformation at the grassroots? Thank you.
This is something I've actually thought quite a bit about. And this is sort of just from my experience as a journalist, and hopefully it's to your point. But one of the things that, and my colleagues and I, we talk about this all the time, is that the level of communications during the pandemic coming from health officials was often very mixed, very muddled, not very clear, and then absent altogether, especially in recent months. And I think that part of it is, whether it's like pre-COVID or not, there has been this like reticence to be maybe more open and transparent. And, I think that there's been many like news briefings and things. Like, I'm not trying to say that we don't hear from, high-level officials or leaders who are trying to explain some of this stuff. But I think on measure, I think there's just too much reluctance to really get into the weeds and say, you know what, we just need to tell people vaccines are safe and effective, they work. Let's not get into all the details. But the details are where a lot of people are going now, and they're reading these studies and they're sharing them with their anti-vax friends, and they're really like, Tim and I were talking about this before, like the studies that they're sending us, and like the Pfizer papers and all of the conspiracy theories. Like, this network goes so deep, and the things that they think are like the smoking gun. And I think that the reluctance to really get, and I'm not saying we need to like start debating anti-vaccine activists on Facebook groups. So I think what I'm saying is that there needs to be maybe a thoughtful approach about how to be maybe more open and more transparent about the fact that here's why we're changing this recommendation. Science has changed, and so are we. And here's the 5 things you need to know, or whatever it is. I think that that's something that's really been sorely missing, whether it's on masks, vaccines, you name it. Just that maybe just more open and frank, leveling with the people about here's why things are changing. And that's my thought as a journalist anyway.
We have time for one short question and a couple of short answers. I'm sorry, but our time is coming to an end. It's over to that mic.
Okay. I'm Charlotte de Keyser. I'm at the Treasury Board Secretariat of Canada. And I have a question about taking a strength-based approach in addition to kind of battling misinformation, trying to preserve the democracy that we have. So what are some ways that we can take this crisis as an opportunity to strengthen our democracy? What are the policy innovations that we can use to strengthen our democracy and build more trust, whether that's co-creation or design thinking, processes for policy making? And open government is a growing trend in the government of Canada. Your thoughts on that would be, really appreciated.
Great. So happy to respond to that. I'm actually going to build on Carly's last point, because I think it's critical to sort of your question, which is coming out of COVID. What we need to do as a government is act differently towards our citizens. And so we need to learn from, sort of the effects that have clearly eroded the trust that citizens have sort of in government. And I think one of the key ones in particular is this idea of sort of operational transparency. We need to let people in to understand government decision making. We need to be sort of more forthright with respect to our complex operating environment. And so it's not, as we have said before, it's not sort of like one in, sort of one out. It's not sort of black and white. Decision makers have to bring in a whole bunch of different considerations into their remit before a decision is made. And I think what is core to that then is letting people sort of in so they understand sort of how their government is operating, so it can be sort of more trustworthy. And then ultimately people will then understand sort of the decisions that are being made. And so if there's one key takeaway from that, I think that is sort of the innovation. All those other, sort of techniques and approaches that you sort of mentioned, I think are inherent in that. So co-development, co-design, co-implementation. that all means that you are bringing people in sort of a different way. So it's a different relationship.
You know, okay, last comment to my buddy, Tim. Go ahead.
I'll be super quick. That wasn't very enthusiastic.
I was thinking at the same time.
Support those individuals who are fighting misinformation. I know that sounds incredibly self-serving, but I'm old and I'm going to be gone soon. I mean, it's tough. We need institutions to support those individuals who want to do this. So that means, you know, researchers not doing it off the side of their desks. It means granting agencies saying this is part of your grant. We expect you to do this. That means Health Canada, Public Health Agency of Canada, putting resources in. All of those things I think are happening. So that is a good thing. We need regulatory changes. We need Health Canada, the Competition Bureau, those who regulate healthcare professionals, all to tackle misinformation and using the regulatory tools that we have, and we need to tweak them so they can do it better. Trust, such a huge issue. We've talked a lot about that, but we have to create these trustworthy institutions. And the last thing I'll say is we need to focus more attention on better communications, building on what was just said by both of my colleagues. We absolutely, you know, I wrote a piece for the Globe and Mail called Science, the Uncertainty Dance, Science and the Uncertainty Dance. And we have got to do a better job of talking about science, about the process of science. And that means partnering with interdisciplinary teams, with artists, with comedians, with young designers, and really making content that matters, is interesting, and can have an enduring impact in the places where misinformation resides.
Well, thank you for that. And I'm just going to sum up very, very briefly here with an observation that nothing in the history of humankind has ever stayed static. And we have to understand that at this historical inflection point, our democracies are changing. The challenge that we have is how? Is this country that we live in, is this globe that is our only one, are we going to change in a way that societies are going to become more open, more compassionate, and more caring? Or are we going to go to a different direction where they become more autocratic, more top-down, and more restrictive? I think this is an inflection point. And I thank the panel so much for showing us the challenges that are there, but also providing us with some solutions. And the challenges are huge and the solutions are challenging. But one of the things about being in a democracy is that everyone in this room, is a citizen. And citizenship comes with rights, but citizenship comes with responsibilities. And if you and I aren't part of addressing this disinformation infodemic that we are caught up in, if we're not part of addressing it, we're actually not discharging our responsibilities as a citizen. A citizen, it's one of the most important concepts that we actually have in a democracy. It's the responsibility that we have to each other, to create a more just society. And my gosh, we have a long way to go. So I'm going to end by asking each one of you, you've heard a lot of good solutions, from helping Science Up First to working in your community. I'm going to ask each one of you to think about, when you leave here today, what are you going to do to address this tide of disinformation? What are you going to do as a citizen, not only of Canada, but as a citizen of this place we call Earth? So thank you all for being here, and thanks to this incredible panel.